Thank you so much for joining us for this very important conversation about addressing mental health challenges and access during the COVID-19 pandemic. My name is Melissa Stevens. I am the Executive Director of the Center for Strategic Philanthropy at the Milken Institute. Today's conversation is part of the Milken Institute series of COVID-19 conference calls where we bring together diverse sets of leaders to talk about different aspects of the crisis and to discuss creative and shared solutions. And like our other conference calls, this one will be video recorded and will be made available on our website. Now, while we are all living through this pandemic, it's hard to know what the full extent of the economic, social, and health impacts will be. But what we do know is that we should not underestimate the impact of the pandemic on our collective mental health. From frontline healthcare workers to food service workers who lost their jobs, from the high school seniors missing graduations, to the elderly seniors who are further isolated than ever before. And in a Kaiser Family Foundation survey that was taken at the end of March, 45% of the adults that responded had indicated that this pandemic was affecting their mental health, and nearly 20% said it had a major impact on their mental health. And we saw a higher percentage of responders for women and people of color. And so as we consider this, particularly in the US, that was already having a mental health crisis, this problem continues to be compounded. Millions of Americans are living with anxiety and depression. We've seen increasing rates of suicide and drug overdose, and we already have a stretched mental health care system. So there is a lot of bad news, as we've already recognized. We do want to have some good news, though. We want to talk about how we can better understand this problem. What are some of the innovative solutions that can be scaled, and how can we really orient ourselves to true systems change that will allow us to rebuild a mental health care system and ourselves in a more resilient way. This is an issue that's of great urgency and importance to our center, the Center for Strategic Philanthropy, but really across the Institute. And we know that it's going to take government, philanthropy, nonprofits, industry, and all sectors really to solve this problem. So we are very excited to have this lineup of individuals to help us really dive into this conversation and dissect the problem and talk about some of the solutions. So we first have Jerome Bettis. Some of you may know him as the Bus, but a Pro Football Hall of Famer, running back, and Super Bowl champion. And the Jerome Bettis, the Bus Stops Here Foundation is dedicated to serving underprivileged youth and helping them to create healthy lives. So thank you for joining, Jerome. We also have Dr. Joshua Gordon, who is the director of the National Institute of Mental Health, the NIMH, with a budget of over $1.2 billion. He leads the federal agency that is really the lead on leading research on mental disorders. Dr. Gordon is both a scientist and a clinician, and so wears both of those hats. We also have Nancy Lublin, who is the CEO and co-founder of Crisis Text Line, which is a nonprofit providing support 24/7 for those who are in crisis through text messaging. So literally support at the tip of your fingers. Now, I will be asking some of the questions, but not all of the questions. So there is a Q&A box on your screen, so you can be typing in questions during this call. We'll be curating them and then asking some of them later in the session. So with that, let's dive into the conversation. We have seen a huge spike in mental health issues because of COVID-19. People who were previously healthy are now experiencing anxiety, depression, loneliness. Individuals who already were suffering from mental illness have had their conditions exacerbated. Let's talk a little bit about this increase in demand. And Nancy, I first want to go to you because Crisis Text Line has seen a significant increase in demand in terms of services. Can you tell us a bit about this increase? What's the magnitude? Are there populations that are disproportionately affected? How would you characterize kind of the texts and the requests that are coming in kind of pre-pandemic and as compared to right now?
Yeah, so thanks for having me. There's nothing like looking at your headshot here also to see just how shitty you look in a pandemic. This is amazing. Anyways, just look at that. Don't look at the video. Look at the headshot. Anyway, so we have seen an increase. We've seen about a 40% increase in volume. We're handling in the US, Canada, Ireland, and UK total about 6,000 conversations a day. What we've seen is two waves of changes. Pre-COVID, we skewed young, poor, rural, and diverse, okay, because we're text and messaging, and that's who text and message is, and there's a veil of ignorance, so we over-index young, we over-index poor, the poorest people in America, rural, and then diverse, 19% Hispanic, 12% Black, 5.5% Native American, 44% LGBTQ. That was pre-COVID. Post-COVID, two things have happened. In wave one, we saw massive anxiety. And the anxiety has echoed the locations where COVID is showing up most. And the anxiety is using words like freaked out and panic and symptoms, wondering if they have it or someone who they love has it. That was wave one, and it continues. But wave two is the impact of three things. It's the impact of the death. So we are seeing an increase in grief and bereavement. Mm-hmm. It's the impact of the quarantines themselves. So we're seeing a huge increase in domestic violence, so 78% increase in domestic violence, 44% increase in sexual abuse, an age shift from young people to 18 to 35 is now our biggest group of texters because they're the ones most disrupted by quarantines. Their jobs disrupted. They were adulting and living in college or living on their own, and now they're back home in their childhood bedroom. Or they have small children and they are now home with those small children. They can't date. 18 to 35 are really the ones most disrupted. And then the third thing is the economic impact. And so 32% right now of everyone texting us indicates that they have a household income under $20,000, household income, the poorest people reaching out to us. So it's the first wave and the second wave. We expect the second wave to last a lot longer. I will say one thing, though, that I want to point out. There is good news, tiny little pieces of good news in places. We have not seen an increase in suicidal ideation, and we have not seen an increase in imminent risk and actual suicides yet. I know that the media has pointed out a couple of terrible stories, and every loss is obviously horrific. We think that that may be part of phase 3. In the last 2 weeks, we have seen depression and isolation eclipse anxiety as the #1 thing that we see as people really settle in and think about this new reality. And as people leave quarantine and leave being around other humans and go back to other things, we fear that the increase in suicidal ideation and imminent risk is coming.
Great. Thank you, Nancy. And also thank you for, you're wearing Steelers colors right now, so I bet Jerome's thanking you for that. I want to turn to Josh now to piggyback off of that and tell us a little bit about what you're seeing, the data that you're gathering, you're analyzing through the National Institutes of Mental Health. What do we know? What do we not know? What have we learned from previous crises that may give us a little bit of a preview as to what's to come?
I'm going to start with that last question. What do we know from previous crises, whether they be disasters or epidemics? We know that what we're seeing now, thanks, Nancy, for that really wonderful description of what's happening on the crisis text line, but we know that that is what we tend to see after crises of any sort. We see increases initially in anxiety and depression. Those acute reactions then give way to more chronic reactions, with diagnosable mental illnesses rising to quite high rates sometimes. After Katrina, up to 50% of the people who lived in affected counties had a diagnosable mental illness, most of them post-traumatic stress disorder. It's at that point when the acute reactions become more chronic that we become much more concerned about rises in suicide rates, disabilities because of the mental illness, significant functional disabilities. So that's what we're trying to forestall now, right? We have these rises in symptoms, and we'd like to see what we can do to prevent those symptoms from leading to chronic mental illnesses. And we'll talk more about it, of course, later, but there are preventative measures that we hope to be able to install. There's a lot of things I should say that we don't know about COVID. Unlike previous disasters, COVID is affecting broad swaths. Probably everybody in the United States is affected. And Nancy nicely pointed out that it's really a three-headed monster. You have the virus itself, you have the mitigation measures, and you have the economic impact of the combined virus and mitigation measures. And those three impacts can be devastating for some. We know that those are at greatest risk are those who have multiple stressful experiences. And so many of us now have multiple stressful experiences because of the COVID pandemic. One final note I'll say is we are very concerned about first responders and other essential workers who are having to expose themselves to risk continuously. We know that kind of chronic stress can really exacerbate existing mental illnesses and can lead to new mental illnesses in people who hadn't had them previously. So with that, I think I'll turn it back and we can continue the discussion.
Great. Thank you, Josh. So before we go to Jerome, I want to ask Nancy, you and Josh again, to reflect on how, we're seeing this increase in demand. What are the models where we can increase supply of services, of treatments? And you just mentioned, Josh, that there were some opportunities around prevention. How do we prevent or decrease the demand? So would love your thoughts on that.
Well, first, on the prevention side, basic coping strategies can be really helpful. Providing for everyone's basic needs, making sure people have enough food, that they're not wanting for shelter and clothing, that they have social interactions. Social distancing does not have to mean social isolation. These we can all work on both as individuals and as family members and as community members. The next step of prevention is ensuring that people who are at risk get care. We don't know exactly who is at risk for developing chronic serious problems, but we do know that we can reduce that risk with acute care. Support groups, peer support are one mechanism. This day and age with social distancing, fortunately, we have good evidence that telehealth approaches and digital health approaches like the text line can be really helpful. And those are probably our most promising ways to increase access. We can't train a whole bunch of mental health professionals in the next few months to ensure that we have enough people to react to the COVID pandemic. So instead, we need to make better use of the people that we do have, using peer support, using family and community navigators, using telehealth and digital approaches. We can help extend the reach of mental health professionals to treat and prevent mental disorders.
Nancy, other thoughts here?
Yeah, I mean, I would just say we were kind of built for this moment. Like, crisis text line has always been 100% remote. So we've trained more than 30,000 people, and we've always been what we call pants optional. Everyone's always been at home on their couch, on their laptops. And and look, it's right now we have a 90% approval rating from our texters. I mean, everybody is miserable who's texting us, and yet they're giving a 90% approval rating. So we're kind of showing that peer support telehealth can work, at least in this slim swim lane that I'm in with crisis intervention. I will say, because there's so many leaders who are participating here, that there are a couple of things that we're seeing in the data that work, that everyday people can do that don't even require training. So some of the words that we're seeing that are really effective, right now it feels very overwhelming, and people are all talking about, like, what am I going to do with my teenagers for the summer? And what about school? And will my college kids go to school? One of the things that we're seeing work is to shrink the time frame down into something bite-sized. What are you going to do tonight to feel strong? What are your plans tomorrow or this weekend? So making it more manageable, we're really seeing as effective with employees, with family, with anybody. They're magic words, shrinking it into something manageable.
Yeah, great. So Jerome, this is a great segue into the work that you are doing. So Jerome, you played for the Steelers for 10 seasons, so there's a special place in your heart for Pittsburgh. And you have teamed up with an effort called Embrace Pittsburgh, which is being driven by Citrone 33, supported by philanthropists Cindy and Rob Citrone. And the goal there is to champion mental strength throughout the Pittsburgh region. And the Embrace effort recently launched a series of family-oriented videos that offer these kinds of coping skills, which are based on the proven intervention of dialectical behavior therapy. So tell us a little bit about your decision to get involved in this program, and again, the importance of these types of coping skills, given, in light of where we are with this increased demand that we've just spoken about.
Well, yeah, obviously there is definitely the increased demand, but let me tell you kind of how it came to be that I got so involved. Obviously, Cindy Citron is a really good friend, and Rob, and they introduced these mind hack videos to me, and they wanted me to be a part of it. And once I understood what it was and the benefits, I was 100% aboard. But all of this kind of came to a head about a week and a half ago. I got a phone call from a representative in the Steelers, and he had got a call from a person who was working for the Steelers training camp and was a teacher. And in her school district, there was 60 kids that didn't have access to computers. And so what we did was we set up a crowdfunding page, and within 24 hours, we were able to raise enough money to get those 60 computers. But what I found out and realized was that this was a rural area, but then we also found out that in the inner cities, we were having issues with the technology gap. And we saw we needed to bridge that digital divide that exists so that now we can provide and try to be a stopgap, if you will, providing that technology. Because we've all thought because technology has become more affordable that everyone has the technology needed. And as we're finding out is that there's some children that are being left behind in this digital age because they don't have the technology or they don't have the internet access. And so we've got to try to help, because what we're seeing is those same kids that need that mind hack video to help with coping with their mental health issues, they don't have the access needed. And now, and I heard Dr. Gordon earlier say, talk about social isolation. But what's happening is these kids don't have the ability to go see the doctor or someone that is helping them. And so the only way you're able to get the information or the videos to help coping with their mental health issues is through the internet. And now they don't have that access. So it became an issue. Rob and Cindy Citron quickly saw that there was an issue. So they've donated another 100 computers, and we're trying to help in that regard. But it's a difficult process, but I think it's one that it's a unique issue that we can handle, but we've all got to do it together.
Yeah, great. Thank you so much, Jerome. And I want to underscore there, sitting where we are thinking about the power of philanthropy, it's a really unique asset class that philanthropy can move quickly, it can be flexible, it can respond to the needs of the community, and it sounds like that has played out for you at the Bus Stops Here Foundation. And so the work that you're doing is for children. Let's talk, continue a little bit more on for talking about vulnerable populations. Josh, would love to have you weigh in here from are there things that we need to be thinking about in particular for children, but also on the other end of the spectrum with those who are the elderly who are in social isolation, perhaps more than ever before. How do we need to be caring for them? So could you kind of take us through your thoughts on caring for those two populations?
Recognize that. Oh, I'm muted. No?
Yeah, there you go.
Okay. First and foremost, with children, we need to recognize that they will have mental health needs as well. But they may not be worried about the things that we're worried about. They may not be thinking about the economy. They may not be thinking about the threat of viruses. They may be thinking about the fact that they can't see their friends or that they're missing their prom.
Mm-hmm.
So it's really important from a family perspective, from an individual perspective, to reach out and ask questions of our children and to listen to them and respond to those needs. Then the question is, how do you take care of children who might need more? And we have to frankly admit that we don't have as much data, as much studies on the use of teletherapy and digital health approaches with children. We have some, and most of that is with really young children working through parents. So we probably need to study what we're doing now with kids in that space of delivering remote treatment and make sure that we make it as efficacious as we can and perform those studies on the fly because the need is great right now. On the other end of the scale, with the elderly, there is actually a good amount of evidence that digital approaches can reach the elderly, but there's also a lot of individuals in the elderly population who aren't as facile with or don't have access to these digital technologies. So we need to think beyond digital technologies. We need to be thinking of the phone and, yes, the text lines and other approaches to reach this population. That can be really challenging, but one of the best ways to do it is in collaboration with primary care providers. Most individuals who are elderly, they have primary health care providers. They have doctors that they trust. And so things like what we call collaborative care models, so where mental health professionals work with primary care providers to make sure that those primary care providers are delivering evidence-based therapies for the elderly, can be really important. Of course, that's focusing on elderly who reach the attention of healthcare providers. So I want to go back to the personal again and just note that we all have an obligation to reach out to the people around us who need help, who are more isolated. I'm fortunate enough to be hunkered down here at home with my daughter and with my wife and with my dog. But that doesn't mean that everyone in my family is with us. So we make sure to reach out to our grandparents, to our community members who don't have someone at home, and be a support for them as much as possible.
I will just say, Dr. Gordon, that dogs are outpacing cats 2-to-1 right now in our data. So on trend.
And Nancy, can you talk a little bit about the work that you're doing with frontline health workers, as we know that they're particularly stressed, exhausted, anxious about being infected, vulnerable to post-traumatic stress? What are you doing for that group of folks?
We launched an initiative called forthefrontlines.org. You can go there and please share it if you know any frontline personnel, essential workers. And there's two really beautiful things coming out of this. So look, we're seeing about 34% of our volume now is coming from frontline people. So we're hearing from a lot of people working on the front lines. We're also hearing from a lot of family members of people on the front lines, so kids, spouse. Two kind of beautiful things in this data. One is, yes, they are worried about being infected and they are worried about their jobs. But the number one thing that they are worried about is infecting other people, which I just think is freaking inspiring. And then the second thing that's also inspiring is we've seen a huge influx of people who want to volunteer with Crisis Text Line. Because you go online, you go through a background check and about a 30-hour training. And if you pass, and there's only a 33% pass rate, it's easier to get into most colleges and universities in America than it is to become a crisis counselor. But if you pass, you can do it from anywhere. So it's like Lyft or Uber for volunteerism. This is a great time to train. So we've seen a huge influx in people applying to volunteer. The number one group of people who we've seen volunteering, 19% of all of our applicants right now, identify as in the healthcare industry. So these are people who during their day job are doing important life-saving work, and now their side hustle volunteer thing is going to also be helping people. And so, look, there are always going to be inspiring stories and snapshots of resilience, even in the middle of a global pandemic.
Yeah, great. That is inspiring. Jerome, let's turn to you. I want to talk a little bit about about that inspiration. What is the opportunity for celebrities and sports figures to be part of this conversation? Some of the research studies indicate that as much as 80% of people needing treatment don't seek it because of stigma and shame. What is the opportunity for celebrities, sports figures, key influencers to help with the destigmatization of mental health challenges?
I think there's a huge opportunity there because for some reason the public at large believes what the celebrity or the athlete says, sells, or really promotes. So I think if more celebrities, if more athletes came out, talked about the mental health side, then it takes away that stigma. And we're starting to see some athletes speak out about mental health issues, and it is changing the perception of mental health as a whole. So I just think that needs to continue, and I think more activism needs to happen in terms of things that we're doing, not only to talk about mental health, but to support mental health and those initiatives. And so I think every one of us have, as a celebrity or entertainer or athlete, we have an opportunity. And I think we should take advantage of it because of the platform that's been presented to us.
Yep. Yep. And Nancy, you've talked about needing to normalize anxiety. Tell us a little bit more about how can we do that?
So we like to say at Crisis Text Line, we don't have any competitors. Like, we're the only national text line. Like, we don't think of us as having any competitors, but we have an enemy. And our enemy is stigma. And that's an enemy that a lot of people have as an enemy. Individuals, my guess is Dr. Gordon's enemy is stigma. Like, everybody to access mental health, they first need to get over the hurdle of this, like that it's some terrible thing that people should be embarrassed about, or it's some boogeyman like worse than the black smoke and Lost. And that's the thing that we fight against. So we just try and make it as easy as possible for people to get help. So texting us at 741-741. So Jerome, if you want to get all your athlete friends, promote that. 741-741 in the U.S. and Canada, and 85258 in the UK. There's no intake survey. There's no thing that you download. It's free. And because there's a veil of ignorance and you don't see anybody or hear them, there's no bias. So I think that's why we're able to reach such diverse people, and that 68% of everybody who texts us says that they've shared something with us they've never shared with another human being. So we're a gateway, and we try and then say, well, if this felt good, and like I said, 90% of people say that sharing with us felt good, how about reaching out to your doctor or to your coach or talk to your husband? Like, pick another person in your life to try and open up to, because it's a safe thing to do. And on the open up, I would also suggest that when we ask people, instead of like, how you doing? Well, no one's doing great right now. Except for the people who own Zoom, they are doing very well right now. Everyone else is not. But so instead of saying, how are you doing, where there's no great answer, instead ask people, how are you on a scale of 1 to 5? Give someone a specific, and let them tell you there are 2 or there are 3. It opens up, especially, by the way, I would say for the middle-aged men. It's really, for most of them, they have not opened up about their feelings before, and now they're in like a feeling mode. And they're actually the most likely to complete a suicide attempt. They are the least likely to seek help. So to give them a question that's an easy answer, how are you feeling 1 to 5? Well, you have to answer that. You can't say yes, no, or okay. You have to give a number. And that's the beginning of a great conversation.
Great. Thank you, Nancy. So I just want to remind folks that you can submit questions in the Q&A box. And we're going to get to those in a moment. But I want to go back to the group here as we think about the Build Back Better. This is really an inflection point. It's a defining moment in our lifetimes around the world. There's the saying, never let a good crisis go to waste. How do we take advantage of this moment to put a spotlight on this and to really build a system that is better for everyone? How do we find the insights, the resources, the political will, again, to drive real systems change? So, Josh, maybe I'll start with you.
So we need a healthcare system, a mental health care system in the United States that is capable and effective at treating mental illness. I think it's really important that we engage stigma directly, but the best stigma killer is something that we can do to help people. Because the more people get help, the more people realize, you know what, this is something that I can get over. And this is something that's worth admitting because then I can get help that will really help me. The truth is we have a lot of effective therapies, a lot of effective preventative measures that we need to do a better job of getting out to the communities that need it. When we think about the mental health effects of COVID, we know already, we've been hearing the news, right, that the physical effects of COVID are more devastating in minorities, in socioeconomically disadvantaged communities. That's also true of the mental health effects. We need to do a better job of providing access to care in underserved settings. We also need to do a better job at figuring out what works through what we like to call a learning healthcare system. Ensure that when people are enrolled in care, we're studying what works for them so that we can develop and improve our interventions and make sure that we are reaching the right people with the right interventions. This is not pie in the sky stuff. We at NIMH are building them in a research setting, and we are engaged with HMOs and healthcare organizations and hospitals and community mental health centers in making sure that happens. You're already hearing of the crisis text line and how they can turn around and use that data to inform what works and help spread the word. And community-based interventions like what Jerome is doing in Pittsburgh are also playing a role in reaching more people with evidence-based approaches to mental health care. So the more that we can do to maximize the use of these approaches, the more that we can do to make sure we're adapting them to make them available to a wider range of the American public, the better we're going to come out of this pandemic as a stronger and healthier country.
Great, thanks, Josh. Jerome, can I turn to you to think about how you're thinking about Build Back Better? How are you thinking about scaling what you're doing? What are the opportunities for other philanthropists, for corporations, for other influencers to be part of what you're doing, helping to get technology to reach these populations that don't have access? How are you thinking about that?
Well, what we've started is we've started to receive a lot of requests from different communities and really from different areas of the country. And what we're going to look at doing is really trying to partner with companies in those areas so that they can provide a local service to their communities. And so in Pittsburgh, we're doing the heavy lifting, and in Detroit, where I'm from as well, we want to be involved, and we're going to find a partner in Detroit. But what we want to do from a scalable process really is, one, identify the need, and that's what we're starting to do now as people from different school systems are reaching out to the foundation. And once we're able to assess the issues there, then we can go out and look at companies that have a like-minded attitude, that want to go out in their communities and make a difference. And that's what we're starting to do. But we're also taking the donations from anyone who's willing to do that, so that we can provide more opportunities as well. So it's it's definitely a community approach, and it's going to be a national approach. But when we feel that once we can identify the need, then we can start going forward from that process.
Great. And Nancy, what are your thoughts on this? Is in your ideal, it's a blank canvas or in your go forward, what's your ideal state? What's your wish list? What's your charge to those who are on the phone to get to a state of better?
Then avoid getting help. That's our goal. And last week we were blessed. We won something called the TED Prize, the Audacious TED Prize, and we announced that we're going to be expanding to 5 languages globally. And we had originally planned on doing that in 5 years. And 5 years is just a luxury right now. Who's planning for 5 years? So we hired a new CTO out of Uber, and on his 4th week, I was like, "How fast can we do this?" And he said, "I can cut it 50%. So we're going to do 5 languages globally and cover 32% of the world in the next 2.5 years. So I'm going for it. I don't know what the equivalent would be, Jerome, in like football, but I'm going for it. And I literally have black jeans on, so I'm totally dressed like a Steelers fan today, although I'm like a 1980s Giants fan, but that's a different conversation. Anyway, so we're going for it with massive expansion. We'd love to help fuel more research. There were a couple of questions here on the side. I'm hardcore about our texter safety. Like, I'm not a for-profit company. I'm not funded by the government. We are not blinded by anything but providing the best possible care to our texters. And so the American privacy standards are kind of meh. So we built to the European privacy standards. So we're hardcore about our texter privacy. The data that I've shared, like 78% increase in domestic violence and 44% increase in sexual abuse, is from the conversations, which we can aggregate and anonymize in real time, so we get data all day long. We also send out an explicit survey at the end of conversations that texters can fill out. We actually have a 19% response rate to that survey, and we had an imputation study done showing that it is statistically representative of the entire corpus. So that is all to say, we're open for research. And so we would love more academics who go through an IRB process. We've had 11 papers published so far. There are 9 more coming. One of my favorite papers was comparing weather patterns to our data, and that showed that any extreme weather patterns, extreme heat, extreme cold, extreme rain, mirrors anxiety and depression growing. There was another study done out of Ohio State on the language of child abuse. And it turns out no kid uses the word abuse. Like, that's not a term a kid uses. The kid uses "my blank is mean," and sometimes he blanks. Like, there's a whole sentence structure to it, and the word mean shows up. So we're open for research. I would love more people to learn from our data. It's free. You can query it quite quickly. And so we want to fuel a whole world of Dr. Gordons looking at and learning from things so that we can get to prevention. And then lastly, we want to fight that stigma and help every doctor and psychiatrist, psychologist, program, school counselor to make it easier for all of them to have these hard conversations. We just want to be a gateway. So the more people try crisis text line and like, wow, sharing actually, that felt pretty good. They validated my feelings, and wow, I am stronger than I know. Gets them a step closer to being able to do it with somebody else.
Yeah. Awesome. So we've had a number of questions come in. The first one I want to pose to the group is around access and what's prohibitive for access is that insurers aren't necessarily covering telehealth services. How do we move them to cover? And what are all the services that are available for the uninsured?
So
Nancy?
I'll let Dr. Gordon start with this one.
I can start, and I'm sure Nancy would point out that the crisis text line is available to uninsured individuals.
Yeah.
They're available to everyone. There are a lot of services that are available to uninsured people. Hotlines, text lines, Most locales have a community mental health center. It's often integrated within a community health center, but it's there, and they're supported by the federal government as well as state and local governments. Those are available. The other issue with access, as was mentioned before, is if we're trying to move to use tools like digital tools for access, we need to think about how individuals access the internet, like what Jerome is working on. They need devices. They also need Wi-Fi. So we can consider that part of the public mental health apparatus as being really crucial for gaining access. At the heart of it, though, I think one of the main limiting factors right now, particularly when we talk about accessing underserved communities, accessing rural communities, and care for children, is a true lack of providers, a true lack of providers. So the work of Crisis Text Line and others in expanding the provider pool, training peers, training community health workers, et cetera, in mental health care is key. And I'll add one more thing to the stigma piece. It's not just people who need care that feel the stigma. It's also the people who provide care that feel the stigma. We have a wonderful set of research programs that are exploring ways to reduce provider stigma so that they understand the needs of their clients and customers and patients for mental health care, and not just the needs, but also the availability of approaches that actually work. So we need to think about that as well in terms of expanding access.
Great. Another question, back to companies. How can companies help employees who are working from home to keep work and life separate and manage the stresses that come with that? Any thoughts?
I'm happy to say what we're doing. We're not a company, but I have over 1,000 people who work for me, and we actually, the NIMH is one of the National Institutes of Health, as you're probably aware, and there are 27 such institutes with a workforce of 30,000, and NIMH is helping the NIH generally. So we want to make sure that information is available to our employees about their risks for COVID, about the way they can mitigate those risks, that they know if they have to come into work, although most are teleworking, that they have safe ways of doing so safely. We provide flexibility to our employees to make sure that if they need to work at different hours because they have to split childcare with a spouse, or if they need to reduce their working hours because they have to spend time on childcare, we try to give them that flexibility. And we try to make sure that they have resources available to them. I realize I didn't quite answer part of the question last time about paying for telehealth. I think it's incumbent upon companies to make sure that the insurers they use are doing what Medicare and Medicaid are doing right now, which is allowing full reimbursement for telemental health. I think it's really important. Employers have a role in negotiating that for their employees.
So we touched a little bit on this in the conversation, but wanted to circle back around. What are we expecting when the quarantines start to lift and we start to get back to normal and open up, the economy opens up again? How are you expecting? Can we touch on that again around what we're expecting to see in terms of the mental health challenges during that transition period?
We're expecting that eventually the virus itself will be curtailed, if not quashed. I think to assume that that's happening in the next few weeks is naive at best. I think it's going to be a long journey that will not be linear. And I think that the scar of the mental health repercussions is going to burn for years. That the impact of that triumvirate that Dr. Gordon and I talked about, the virus itself and the impact of the virus itself, the quarantines and the impact they've had on people's lives and families and health, and the economic realities, all three of those things are going to impact individuals and communities and their mental health and well-being for years.
Jerome, we have a question for you. With the pandemic, foundations have been they've been rethinking their strategies as to how to incorporate COVID programming. How have you thought about? You've obviously talked about what you're doing with the computers and technology pieces, but how have you kind of really balanced how much do you stay the course and how much do you allow for kind of the mission creep, so to speak, in turning your resources and programming towards a COVID response? And I think that's challenging for nonprofits and foundations who are thinking about, do I need to have a COVID angle to secure more funding? Or do I really just need to focus on what I was already doing? So could you talk a little bit about how you kind of balance that?
Yeah, it is a difficult situation that most foundations are in, especially with, let's say mine. We deal with underprivileged and at-risk kids, and we try to deal from an educational standpoint, and that's our goal. So what we try to do is we look at this COVID situation, and we see is our core issue being affected by this disease and this issue. So what we've found is that yes, education is a big problem because kids don't have the access. Once all the schools got shut down, then it became a crisis that no one talked about, and that these underprivileged and at-risk kids did not have the necessary technology and didn't have adequate access to the internet. So, you try to look at what your core responsibility is in terms of why you started your foundation. And for me, growing up in Detroit, I was affected as a kid. There was a foundation that helped me, and in turn, I wanted to try to pay it forward. And if I can find something that makes sense in this COVID issue area that we're dealing with, then I'm able to do that. But the root of it is all hands on deck. This is the issue that we're dealing with right now. So we need to look at all of the resources and try to pool them to affect what's happening right now. So yes, the education piece is critical. It's important. But right now, pertaining to the COVID issue, that's what we want to address. And I think that's what most foundations are really starting to look at. How can they help in this pandemic that we're dealing with, and also be true to what our mission is?
Yeah, great. Nancy, I'm going to throw one to you. There's a question around what is the biggest blocker beyond stigma to activate digital solutions to improve outcomes in this space?
I know I'm supposed to say money, but I don't actually think that's the issue. I think there's always money for innovation. I think it's will and creativity. Honestly, I think I'm going to go out on a limb here, and let's have fun. And I wonder how people react to this. I've been an entrepreneur in other spaces before. I've never been in a snobbier space. The mental health space is unbelievably snobby. And I have fancy advanced degrees, but I don't put them at the end of my name and my email signature. The mental health space, and by doing that, we keep low-income people out, we keep lived experience out, we keep Black people out, and there aren't actually that many women in leadership roles I've noticed in this space. And the worst part is you limit innovation, because look at the biggest innovators that we have in the world, Bill Gates, Zuck, they don't even have college degrees. Like, if you want kick-ass telemedicine, innovation, tech startups in the mental health space, you're going to have to stop requiring everybody to have a damn PhD. And you're going to have to get over some of that stuff, because that's not where the best work is happening. is writing a PhD for 5 years on some limited small expertise and study that you do for 5 years. You're sidelining some of the best talent. So throwing it out there.
I feel like I need to give you the floor, Josh.
Exactly. Sorry.
On what Nancy says. And I think she's right in that there's a lot of innovation in the mental health space. There actually is a lot of innovation in the mental health digital app space. A lot of it, though, is not targeted at serious mental illness. It's targeted at well-being, making sure you're getting sleep at night, making sure that you can tackle the daily woes of your jobs and your school life and your personal life. Not that those aren't important; those are really important. But taking it up a notch and bringing that creativity to bear on serious mental illness and helping people with devastating and debilitating conditions requires a little bit more. Maybe the engineer doesn't have to have a PhD, but we do need careful studies of these things to show that they do work. And there are really very few companies that are taking that extra step of proving that their devices, their apps, their software works for people with serious mental illness. And I would say that's a gap that we are trying to fill at NIMH. But I'll give Nancy one thing: the innovators are not necessarily the PhDs and academics who've been doing this for 30 years. Although they're trying, it's true we need a little bit of new blood.
So Nancy raised the challenge of ending on a high note. So I want to ask all of the speakers to share what really gives them hope, what keeps you going, what gets you out of bed in the morning, and knows that we, and lets you know that we can do better. Jerome, I want to start with you.
What gives me hope is just looking at all the people that have decided to help. We put a crowdfunding page up, and once people heard about what was happening, what was going on, we got donations, $5, $10, and it just showed that so many people care about what's going on. Yes, they may not have the means that a lot of people have, but their heart is in the right place. And in a pandemic like this, it's great to see that everybody is coming together to solve some of the issues that we have. This mental health issue is important, and to see people coming together, wanting to be a part of this, that's the exciting part of what we're doing at the Bus Stops Here Foundation, because it shows that people are committed to each other. And once we come through this, I believe that this country is going to be much better for it, because we're having to think about each other as opposed to just thinking of ourselves.
Great. Nancy, what gives you hope?
I mean, look, we've trained these 30,000 people. 8,167 of them have been on the platform in just the last 28 days. That's huge. It's really sticky. And we've trained, those 30,000 people have been trained over 6 years. So to have more than 25% of them on the platform helping in the last 28 days, when they're likely feeling pain and anxiety and depression and isolation themselves, is really freaking inspiring. I mean, they're not getting paid. They do it 24/7. They come on the platform at all different times. Our volunteers, our crisis counselors, we nickname them empathy MVPs. They all deserve, what's the equivalent of like a Super Bowl ring for empathy, Jerome? People need like Super Bowl rings and empathy. They're showing up and they're loving on strangers, like strangers helping strangers in their darkest moments. That's beautiful.
Wonderful. Josh, what gives you hope?
Well, what gives me hope is the fact that every challenge, and COVID is no exception, is an opportunity for growth. And I'll flesh that out with a few New York stories. I'm in New York right now. That's where my home is, and fortunate to be able to telework from there instead of having to commute every week to DC. This is the third crisis we've had in New York since I've lived here. I moved here about a year before, a few years before 9/11. We lived through Sandy, and now we're dealing with COVID. And COVID is by far the most pervasive in terms of affecting everyone. But you see the city rally each time, and you see the city learn from that. People learn to come together. A living experience of that is every day at 7 p.m. I walk out my front door and I hear everybody. I live in a diverse neighborhood. It's probably a third Hispanic, a quarter Black, and the rest white. And everybody's out there on their balconies or opening their windows, cheering, clapping. There's a lot of Jews here. We blow the shofar, which is a ram's horn we blow on high holidays. We have people blasting all kinds of music, but it seems to always end in New York, New York. And it is really inspiring to see people come together, and they're doing it because they are home all day. They're doing it because they are sheltering in place. It is tragic to see the pictures of crowded beaches or crowded lawns in Central Park, but the vast majority of people are rising to the occasion, and that's what gives me hope.
Great, thank you. Well, as we come to a close, I first want to remind everyone that this conversation was video recorded. It will be on our website, so share with friends and family afterwards. And I also want to take the opportunity again just to underscore the importance and the urgency of this issue, that we need to take advantage of this defining moment in the world right now to prioritize mental health and to build that system back better for everyone. And I think we've heard Jerome say on the field that we're playing to win, we're not playing to lose. And so, Nancy, I actually want to take your Steeler outfit and raise you with some terrible towel action here because we're playing to win. And I think that really sums up the sentiment of all of you, the speakers, as well as everyone who is joining us remotely. So thank you so much for your time, for your insights. Everyone, please stay safe and stay healthy. Thank you.
Thank you.
Thank you.